So TAMIS is an abbreviation for transanal minimally invasive surgery, and basically it's a newer surgical technique that allows us to remove benign lesions of the rectum and also well-selected early cancers from the rectum in a minimally invasive sense rather than requiring a large abdominal operation. It was developed in 2009 and has been used successfully since that time, and is basically an extension or adaptation of a previous platform called TEM that was developed and it has been used since the 1980s. So the main improvement of TAMIS is that it extends my reach as a surgeon. And where previously, if some of these lesions that were amenable to local excision were beyond the reach of our traditional techniques, we then would require to do a large abdominal surgery with prolonged hospital stay, increased complications, increased pain, and a longer recovery, where now I can reach those lesions and remove them safely through the anus with incisionless laparoscopic surgery. The other advantages are when I'm looking at it, there's increased visualization, and that can lead to better specimen retrieval without breaking the specimen, which is very important for our pathological staging of the tumor. So there's two basic patient groups that will benefit greatly from this surgical approach. The first is patients that have lesions that are either too high for the traditional technique or too large to endoscopically remove with a traditional colonoscope. And those are patients that were normally in the past have had to go through a large abdominal pelvic surgery to have these removed, can now get these removed through this technique. The second class of patients is the patients that have lesions that need removal but are perhaps due to other illnesses they have cannot withstand a large abdominal operation. And now we can offer them this, which is easier for them to go through physically, and they can perhaps benefit from this as opposed to not getting any surgery at all. It has a great recovery profile in that this is a minimally invasive. We're not making any incisions in your abdomen or your pelvis, and it's all done through the anus itself. The area usually where we take these tumors and polyps and lesions from actually don't have pain fibers. So from a pain standpoint, it's a very easy recovery, similar to that of a colonoscopy. And due to the fact that we are doing a resection, we will keep you overnight in the hospital to observe you, but most patients can go home on the second day.